In this video, we listened to Dr Mwena Opie and Dr Boon Lim discuss temperature regulation, sleep and brain fog. There is a lot to say about all of these topics and our short video cannot cover everything, but please do read around each of these topics and do your own research. People with POTS often have problems with temperature regulation. This is because the autonomic nervous system, which is abnormal in POTS, also controls our body temperature. Heat causes blood vessels to widen, thereby increasing heart rate and other POTS symptoms. We will now listen to Dr Mwena Opie and Dr Boon Lim talk about top tips for managing temperature regulation.
So do you have any top tips for managing and staying in that Goldilocks zone with temperature?
Yeah, so it would be mainly to avoid overheating. And so the sensible approach, if you're going out and you're not sure what the weather is going to be like, is to wear many layers. And so layering is going to be a very useful exercise. Some of my patients have cooling vests or cooling mats. I would say get very nice low tog duvet in the summertime or when it's hot, because you'd be very surprised how much sweat you produce when you're under the sheets at night and not waking up because you're sleeping, and then you get very much worsening symptom profile in the early morning. So keeping cool at night can also be helpful. And the challenge there is POTS patients feel cold, don't they? So they want to be warm, but actually being cooler for them is better than being warmer. But we have to try, or you have to try what you can tolerate.
Yeah.
And so those are the top tips. Oh, one other top tip, which is have a thermal flask. So when you're traveling out and about, have a really big volume thermal flask and just fill it with ice and water. So when you're drinking cold water, what it does is it cools your core body temperature down, but it also promotes intestinal vascular bed compression. Remember I said in your intestines, you can have a bed or a vascular bed which can expand when you have food and take away blood from the core circulation you've had in your heart. Well, turns out if you drink cold water, you can contract that bed and think of it as giving yourself a free blood transfusion. So drinking ice water is good because it's hydration, but drinking cold water is even better because you're getting hydration, but you're getting a squeeze of blood transfusion from your blood vessels in the gut, which are going to shut down, like your cold hands in the ice bucket, and it's going to push the blood back up to your core circulation. So those are my top tips.
Nice. And if we put a bit of salt in there as well, it would be even better.
Ideally, salt or isotonic electrolyte drinks. Yes, exactly right.
Thank you.
In summary, and in addition to what was discussed, here are some top tips for managing your temperature regulation. Remember to increase salt and fluid intake if you feel hot or start to sweat more. Have a spray bottle of water at hand for your face and neck. Fans can be helpful and there are a wide range available, including handheld, neck fans or freestanding. Patients tell us that cooling towels, mats, pillows and vests are very helpful. Patients also report struggling with being too cold as well as too hot, so layered clothing is always a sensible idea. There are all sorts of products available to help both warm you up and cool you down, so do some research and find what works best for you. We will now listen to Dr Opie and Dr Lim discussing why patients with POTS so often struggle to sleep and some tips to help with this.
So Morwenna, a lot of my patients with POTS have trouble with sleep, and we know how sleep can impact your symptoms. So do you have any pointers as to why patients with POTS may have difficulties in sleeping, and more importantly, how they can improve their sleep routine?
Well, I think there are quite a few factors actually that are impacting sleep. And I'm really interested in your view on that as well, because I suspect some of the driver, can be to do with having palpitations at night. And as you've discussed before, it's not always the case that once we're lying prone, that tachycardia stops. And I think that a lot of people that certainly I work with still feel very wired at that time of day. And so there's quite a lot of sort of the physiology going on with that, as well as we mentioned a little bit earlier, of managing temperature at night and maybe other factors as well, like sort of blood glucose levels. What's your feeling about some of the key physiological drivers?
So I suspect, coming back to the autonomic nervous system, I like the word wired, because I think a lot of these patients are very wired. And it's not a normal routine. POTS patients who may be housebound or not able to function in a normal day-to-day routine, and slips in the day-to-day, let's say, number of steps or physical activity, can often have this paradoxical feeling that I haven't done enough or I haven't exerted enough, and yet the body and its adrenaline system has been in heightened exertional mode with full of adrenaline for the whole day. And paradoxically, they haven't done many steps on the step counter, but they've done many, many steps inside or in the adrenaline stress system. So the heart rate might be going up and down. And I think this wiredness, or the shift to sympathetic dominance throughout the day for various reasons, is something that can anchor you into a pattern that makes it very difficult to fall asleep or get a good restful sleep. It's akin to me or you having to prepare for a presentation the next morning, 3 hours long, which we don't know anything about. And that level of tension in your system with a slight higher adrenaline, that you're unprepared, that just sits with you, can make you have a sleepless night. I mean, you and I have had these sleepless nights, but with the POTS patients, even without that same trigger, the heightened adrenaline is very similar in terms of sleep brain physiology as going for a job interview or preparing for a talk the next day.
And what we know as well, of course, is that once that the heart is racing a little bit, our brain's always looking to understand why that might be. So in a way, it's already scanning for worries. That's going to be quite a typical time for a lot of scary thoughts to come in.
Yeah.
Including that fear of knowing that sleep is good for us and we're going to miss out on it. And it can really spiral, can't it?
Yeah, I mean, I've had such spirals myself in moments when I'm a bit on call or preparing for a meeting. And I guess the advice, which is mirrored on my own best sleep routine, is literally, well, to read the book Why We Sleep by Matthew Walker. Like, if you haven't read the book, it's a great book, and it's got a nice section on your sleep routine. No blue light, dim lights, no loud noises, no stimulation, these routine things that we talk about. But for me, I put one hand on my chest, one hand on my belly, and I breathe through my diaphragm slowly, and I bring in a positive thought. I sometimes get distracted by my thoughts, which spiral my adrenaline. But when I can do that and just bring myself back to the breath every time, for me personally, it's the best way to deactivate that sympathetic nervous system and shift into beta dominance.
That sounds great, and I think you're right. It starts with what we call sleep hygiene, doesn't it?
Yes.
So in that run up, giving a good chunk of time to start to wind down, and that perhaps for people with POTS, that needs to be longer than that recommended sort of half an hour, that probably that wind down period needs to start sooner. And it's often quite personal, isn't it?
Yes.
With what works, with that routine to calm the nervous system down. And then you're right, when you're actually in bed, potentially breathing techniques can be brilliant. But I don't want people to be discouraged if they struggle with breathing, because we know that some people with POTS do find that focusing on breath can be quite uncomfortable. And I think we're going to talk a bit later about other techniques that people can use to kind of calm the nervous system down as well.
Well, the one technique that I sometimes hear from patients work very well is to get a pair of headphones, which are also eye masks. So you can just buy this very cheaply off the internet. And if you wear this eye mask headband thing with the two speakers here, so you don't bother your partner, and you just pick a voice to walk you through a body scan. And one of the things I had noticed about patients with POTS and the adrenaline shift is that the sensory overload from interoception. So not only are they sensitive to noise and lights and sounds outside or exteroception of your five senses, sight, sound, taste, touch, smell, but interoception. So when they feel the palpitations, and that triggers an anxiety about why they're getting palpitations. And it's a vicious spiral, because when they're anxious, they get more palpitations and it goes in a loop. When you're so receptive to all these things happening around, I agree, it's very difficult to say, oh, that's Zen, and focus on your breathing. So in those patients, putting on a narrative or a sweet voice, I say find a voice on Spotify or YouTube that works for you, and take yourself through a 20-minute body scan meditation, which means a sweet voice telling you to breathe in, breathe out, clench your jaw, relax your eyebrows, your scalp, your forehead, and you keep going down the body, and then you go up again, and you do it as often or as long as you want. That can shift you, because you are no longer thinking, you are listening to an instruction for you to do something, and you can follow that instruction from an external stimulus that hopefully kills your interoception ability to detect your palpitations, your heat, your...
Absolutely.
Yeah.
And sometimes even an audiobook or a podcast can be great for that too.
Yeah.
I think it's quite interesting as well that we know that there is a reasonably high proportion of people who have POTS also have ADHD. And so there are some similar narratives there about sometimes distraction is actually really, really helpful rather than silence.
I would add to that white noise, right? Just playing on your speakers, the sound of rain or literally white noise.
Absolutely. And I think it's probably worth mentioning that this is actually a really important factor to focus on, isn't it? Because we know that everything's worse when you don't sleep, both emotionally and physically. And in fact, there is also some research that suggests that people who struggle with their sleep are more likely to report really extreme emotional problems, including thoughts of hurting themselves. So I guess I'm really pleased we've given some time to this today. And I think it's something to really encourage people to seek some additional support with if they're struggling.
Sleep is critical for both your physical and mental health. Please do approach your GP if you feel you need further support in this area. In summary, and in addition to what was discussed, here are some top tips for managing sleep. Ensure basic sleep hygiene advice is followed in the first instance. This includes things like creating a restful bedroom environment, stopping using electronic devices at least an hour before sleep, avoiding stimulants like caffeine later in the day. Read up about good sleep hygiene and try to implement these. Other helpful ideas include body scan meditations, audiobooks or podcasts to help you relax. Aiming for a consistent going to bed and getting up time in line with your natural rhythm. This helps to establish a good sleep routine. There are lots of apps available to help with sleep, so have a good look at these and see if you feel if any may be of benefit. Be aware over-the-counter sleep medicines usually contain an antihistamine, which can worsen symptoms of POTS such as tachycardia and fatigue. We advise you to speak to your GP or pharmacist about this before using. Dr Opie and Dr Lim will now discuss brain fog, a common and very frustrating and often debilitating symptom of POTS.
It is one of the symptoms that people report very, very commonly and really often find the most distressing. Because you can feel very removed, I think, from yourself when you find that you are struggling with things like difficulty with memory, that feeling of things being on the tip of your tongue but not quite able to articulate them, and really struggling to feel really present as a result of that fogginess. I think the interesting thing is that the research about that, certainly from my point of view, is quite limited for us to understand exactly what's going on. Do you have a theory from a physiological point of view about what's happening?
I have a couple of theories, and these are not substantiated, but in looking at the tilt data that I see in patients with POTS, there is this period. There are periods of oscillations in your blood pressure mirrored by oscillations in heart rate whenever you stand up. And what I think may be happening, which causes a degree of brain fog, is a pulsing pattern of a high adrenaline and sometimes a high blood pressure, what would be considered hypertensive. And then 10 seconds later, hypotension and a heart rate that then drops back to a normal range. 10 seconds after, hypertension, high blood pressure, and so on and so forth. So in other words, you are yo-yoing with your blood pressure and heart rate, and this yo-yoing impulse to the brain circulation is something that the brain doesn't like to deal with. It impairs cognition in a way that may make patients have difficulties in concentration, which characterizes the brain fog. So there's one theory.
And I guess we know, don't we, that when we're experiencing any kind of stressor, our brain sort of moves the energy towards the mid part of the brain, the very reactive part.
Yes.
And sort of closes down energy away from the area where our memory is, where our cognition is, where all our thoughts are. So I guess there's potentially a physiological change going on in response to all of that as well.
Yeah, so one way to say this more crudely is that a sympathetic stress surge gives you a lobotomy, which means that the stress actually makes you shift into the primitive brain that is a fighty and flighty brain. It knows how to run away, knows how to fight, but doesn't have the ability to handle an Excel spreadsheet.
Yes.
Or send an email.
Find the way home.
Or find the way home or work your mobile phone. So I think that's the simplest way to think about brain fog. It's not simple brain fog, but one way to think about it is that stress impairs the ability for the brain to function properly.
So we're back, aren't we, again, to learning about ourselves.
Exactly.
About managing our levels of stress. And of course, it's really uncomfortable when brain fog kicks in and we can perhaps start to panic about if we're going to get home safely. But more than ever, this is a time to work out how to use breaths, how to use distraction, how to look after ourselves and really let ourselves regulate.
Absolutely right. Shift states. But, I also recognize that's not the only thing. I mean, we are in this series going to talk about different strategies. It is important to emphasize that there's not one strategy that will cure all your symptoms, right? We need to work on all the facets on this ground floor of the house to try and get everything together, because every little helps.
And I guess brain fog can be particularly challenging for those who are trying to study or are trying to work in some form. And I think the unpredictability can be really difficult. Do you have any tips for people about strategies to help when they're needing to rely on their brain functioning at its best, as well as trying to stay nice and calm?
Yeah, so, I was reading very recently on the ability to focus, and even in the absence of POTS, focusing hard for more than 3 hours is challenging. And I guess you have a zone in which you can maximize your output in terms of your cognitive output, and you should embrace those moments. And so my advice would be to find the conditions and the time of the day which gives you the best feeling. And for some it might be morning, for some it might be after lunch, before lunch, whatever works. Find that time and be your most productive in that time. And then set your expectations that for the rest of the day, you're going to recover your health. And that resetting expectations in shifting your work commitments or your study commitments and being realistic about what you can achieve is a way to shift you from a top-down approach as well.
So it sounds like it's really important to work with your body and to kind of work with your particular brain and be really compassionate about that. And perhaps still know that there will be some days where, despite us trying everything, it might not work out, and that perhaps more than ever to be as compassionate with ourselves about that as possible.
Yeah, that's exactly right. Because that, as you say, there will be bad days. Let's not try and jump in this spiral of a vicious spiral that everything is going downhill. It's a blip. And tomorrow you come back, it might be better. It will be better. And over time, there will be an improvement in symptoms in a stepwise manner, with some down days and some up days. But overall, we normally see a trend of improvement with all the patients.
Thank you.
Good.
In summary, and in addition to what was discussed, here are some top tips for managing brain fog. Know yourself. Learn what the best time of day is for you to be productive, and utilise this time well. Be realistic about what is achievable and be kind to yourself. Stay well hydrated and increase your salt intake. Take regular exercise where possible. Avoid unnecessary heat. Lie down to work if your environment allows, or at least elevate your legs. Maintain a steady blood sugar level with low proportions of carbohydrates within each meal, and exclude refined sugars where possible. Some people find that having small, frequent meals helps. You may find using to-do lists or reminders on your electronic devices can be helpful. For more information on all of these topics, please visit www.potsuk.org.